Hello everyone, I'm Dr. Stavani, consultant neuropsychiatrist, Vaidya Hospitals, Nakkal Road, Vijayawada. So, regarding the myths of psychiatric medication, general public still lack awareness regarding psychiatric disorders and what are all the medications we prescribe to the patients. So, we are trying to bring the awareness together, also break the myths regarding psychiatric medication. So, the most common myth about psychiatric medication is that they prescribe pills only no regarding sleep disorders, and they prescribe more sleeping pills to the patients. So that is wrong. There are wide range of psychiatric drugs such as antidepressants, anxiolytics, antipsychotics, anticonvulsants, mood stabilizers, and benzodiazepines. So benzodiazepine is a group of drug which is helpful in inducing sleep, and that is prescribed only to the patients who are having sleep disorders or insomnia, that is trouble sleeping, either in the initiation or in the maintenance. If they're having any difficulty, only then benzodiazepines will be introduced, or along with antidepressants or anxiolytics if they're having trouble sleeping. So this will not be given to everybody who comes to a psychiatrist. Only they'll be prescribed on the basis of need of the patient or the symptoms of the patient and the severity. And the second one is, what is the duration we should use a psychiatric medication? So psychiatric medication should be generally used for about 3 to 6 months for any kind of disorder to reach the improvement level and maintain the neurotransmitter balance. And later, if you are having 100% improvement, will be maintaining you on the lowest dose possible, with which you will not have a rebound of symptoms, which is a maintenance therapy. And for some of the disorders, you need to use medication for a longer period of time, as with chronic physical diseases such as hypertension, thyroid, or diabetes. How are we using these medications for the longer period of time, that is lifelong? In the same way, we need to use few medications for few disorders in psychiatry also for a longer period of time to lead a happy life and not get the rebound of symptoms. Because sudden withdrawal of the drugs, it will cause the imbalance in the neurotransmitters again and produce the symptoms back. So, and the side effects of psychiatric medication. So as with any other medication, even psychiatric medication does have side effects, and most commonly the side effects would be sleepy, feeling drowsy, or weight gain and all. So while prescribing only, we generally tell patients about what are the side effects if they are about to face, and if they are facing, they need to go back to the psychiatrist and tell them that this is a side effect they are facing, so that we'll either reduce the dose or change the medication into the other group, so that you will not be facing any side effects. But as soon as you face the side effects, people generally tend to stop the medication and stop going back to the doctor again, which is leading to sudden withdrawal of the drug, and also not introducing any other drug, so that the symptoms either they maintain in the same level or even may increase because of this. So kindly maintain compliance of the medication and go back to the psychiatrist and explain them or tell them about what are all the troubles you're facing using the medication. And regarding counseling techniques, immediately as soon as a patient comes, based on the severity of the disorder, on the assessment we make, we'll actually introduce a medication first to calm down the patient, so that he'll come back to a stage where he can actually understand what is the being told by him during counseling techniques, or what are we trying to tell him, or what are we trying to understand his disorders. On the spur of the moment, they'll even not be able to tell about what is the trouble they're facing and what they want from counseling also. So we'll calm down the patient first to a level where he can understand what are we trying to say, and where we can understand what is his problem, and then introduce the counseling sessions. Even counseling sessions will be, the number of sessions will be based on the severity of the disorder and the need of the patient. So that is why people will be kept on medication first, and then counseling will be introduced. So if you're facing any side effects with your medication, or if you're finding no improvement even by using medication, kindly go back to your psychiatrist who have prescribed you the drugs, and let them know about the side effects you're facing, so that dose can be adjusted, or there would be any change of drug. But kindly do not stop using the medication abruptly. Thank you.